Lobotomy. You're living in the 1940s and feel life hasn't been about rainbows and butterflies lately. You suspect that you're suffering from depression. But when you go to the doctor, he prescribes that he should stick an ice pick in your eye and scrape away pieces of your brain. That's what lobotomy was all about. So imagine the prefrontal cortex in your brain as its control panel. A lobotomy was like having someone randomly snip a few wires without a manual, hoping it would fix things. Sure, in some cases, patients became quieter and less anxious, but they often lost major parts of their personalities. Many people ended up emotionally flat, unable to function in society, or suffered serious cognitive impairments. In other words, they may have been less agitated, but they looked like robots or walking mannequins. One of the most notorious methods of lobotomy involved using an ice pick-like instrument through the corner of the eye socket to scrape parts of the prefrontal cortex. That procedure wasn't only gruesome, but risky, because an untrained doctor could give you a lifetime supply of eye patches if he made a mistake. By the 1950s and 60s, with the development of antipsychotic medications and better psychological therapies, lobotomies quickly fell out of favor and were eventually banned. Now, instead of drilling into your brain, doctors are more likely to recommend a good session of Netflix and chill to help calm those nerves. Female genital mutilation, FGM. Imagine being a young girl in a small community with traditions that basically belong to the medieval period. As a rite of passage after your first period, they make you go through a process called female genital mutilation, or FGM, which is the practice of removing or damaging parts of the female genitalia. FGM used to be practiced by different communities as a way to control a girl's sexual urges, ensuring they remain chaste throughout their teenage years before marriage. It's like putting a cork in your mouth to keep you from overeating. However, it has no medical benefits at all. It's not like removing a bad tooth that causes pain or fixing a broken bone. Instead, it can lead to serious, long-lasting physical and psychological problems. Women who have undergone FGM can experience infection, childbirth complications, and even death due to the procedure. FGM also violates basic human rights. It's a way of controlling women's bodies, often tied to cultural or social norms that view women as needing to be purified or kept from expressing their sexuality. The World Health Organization and the United Nations have made it clear that FGM is a form of gender-based violence and discrimination. Then there's the issue of consent, because FGM is usually performed on girls who are too young to understand what's happening to them, let alone agree to it. It's not like getting your ears pierced after begging your parents for weeks. Instead, it's a life-altering procedure. Eugenics-based sterilization. Let's say you're not the best student in class because you got a D in math. You're not exactly a star athlete because you're shorter than the average guy and are as slow as a turtle. One day you're being told, "Sorry buddy, we have to sterilize you because you're so mid." That's how eugenics-based sterilization works. This medical procedure was a practice where certain groups of people were forced to undergo sterilization, meaning they could no longer have children. The goal was to improve the human race by preventing people considered undesirable from passing on their genes. It's like editing the family tree and preventing the weird uncles from having offspring, which would also attend reunions and family barbecues in the future. Eugenics-based sterilization could include people with disabilities, mental illnesses, or even those who were just poor. The belief behind eugenics was that traits like intelligence or behavior were purely genetic, so controlling reproduction could weed out undesirable traits. You might think this sounds like a weird sci-fi movie plot. Unfortunately, it wasn't, because countries like the US and Nazi Germany practiced this between the late 19th and mid-20th centuries. The problem was that eugenics-based sterilization violated basic human rights. It was often driven by prejudice, racism, and classism. Imagine being told you can't have children because your skin was of a certain color, or because you flunked out of college. That violates one of your fundamental rights. Eugenics-based sterilization is banned worldwide and is now a sterile topic of discussion among different circles. X-ray acne therapy. Acne has always been the biggest problem for teenagers. After all, that pimple could spell the difference between becoming homecoming queen and the biggest loser in school. So in the early 20th century, doctors used X-ray as a cutting-edge treatment for acne. It sounded like a dream solution because you didn't have to use different facial creams that took days to work. Of course, you didn't have to pop that zit if you got desperate. With just a well-aimed X-ray zap, you could say goodbye to your pimples. Unfortunately, this miracle cure was like opening Pandora's box for skin and health. X-rays are a form of radiation, and while they can be incredibly helpful for things like imaging broken bones or finding cavities, it's not something you want to bombard your face with regularly. In acne therapy, patients were exposed to far more radiation than you'd get from a quick X-ray at the dentist's office. Radiation doesn't just target pimples, but affects all cells. Prolonged exposure damages DNA, which can lead to some nasty side effects, the most serious being an increased risk of skin cancer, particularly basal cell carcinoma. At the time, the risks weren't well understood, and many people were subjected to X-ray acne therapy without knowing the potential consequences. It wasn't until decades later that the medical community realized that while the X-rays might have helped clear up some acne, they were also putting people at serious risk of cancer and other radiation-related illnesses. It's a bit like trying to swat a fly with a cannonball, because it works, but the collateral damage isn't worth it. So you might have your homecoming crown secured, but you won't even live long enough to tell your grandkids about becoming the most popular teen in school. Xenotransplantation. Let's say you need a heart transplant after messing up your ticker with too many burgers and fries. Doctors tell you that there's a shortage of heart donors, but here comes a shady guy who tells you he has a readily available heart. It turns out this heart comes from a cow instead of a human. That's xenotransplantation in a nutshell. This banned medical procedure involves transplanting organs or tissues from animals into humans. It sounds like a good way of fixing the organ shortage, but it's not as simple as telling your dog to be your kidney donor. First, your immune system is a fierce gatekeeper, and it's not exactly welcoming to foreign visitors, even less so when they're from a pig or a cow. If an animal organ is transplanted, the human immune system can go into overdrive, attacking the organ as a dangerous intruder. This can lead to graft rejection, causing the transplanted organ to fail, which kind of defeats the purpose of the whole operation. But the real risk in xenotransplantation is the risk of cross-species infections. Some animal viruses don't make pigs or cows sick, but when they jump to humans, they might cause all kinds of trouble. Scientists call these potential viruses xenoses, and they could cause new diseases that humans have no defense against. No one wants to accidentally kickstart the next trend while trying to save a patient. So while xenotransplantation can solve many medical problems, it also opens up more potential risks that might leave patients oinking instead of snoring while asleep. Plombage. If you lived during the early 20th century, tuberculosis, or TB, was a huge problem because it was a disease that could turn a simple cough into a killer one. Without antibiotics at that time, there weren't a lot of options if you were suffering from TB, and plombage was one of them. TB bacteria thrive in oxygen-rich environments, such as your lungs. So the idea was to take away their oxygen playground by collapsing the lungs through plombage. It's like grounding a kid by filling their bedroom with extra furniture to keep them from playing. Plombage involved surgically collapsing a part of your lung and shoving something like lucite balls or other materials into the extra space to keep it deflated. It was similar to trying to fix a leaky tire by tossing in some marbles for good measure. While the concept might have seemed brilliant then, the long-term consequences were not so great. Having foreign materials left inside your body can cause some pretty serious complications, especially over time. These materials could break down or cause infections, leading to chronic inflammation and even lung cancer in some cases. Imagine finding out decades later that the very thing that saved your life was now causing you a whole new set of health problems. Eventually, antibiotics were developed, which were way more effective and less invasive at treating TB. Once those came on the scene, plombage went from being a cutting-edge treatment to something out of a medical horror story, eventually becoming a banned medical procedure that acted as a placeholder for the arrival of better treatments. Forced electroconvulsive therapy. Imagine suffering from depression, and you visit a doctor to ask for medication. But instead of giving you pills, he straps you on a table as if you're about to become the next coming of Frankenstein's monster, and he puts electrodes on your head before telling you that shocking your brains out is the newest trend in mental health treatments. This is called electroconvulsive therapy, or ECT, which is actually a treatment used by doctors when other mental health treatments don't work. But it's usually used as a last resort and should be done properly under controlled medical conditions. As effective as it might be for some people, the problem is that some patients in the past underwent this treatment without their consent. In a lot of past cases, doctors used this treatment because it was the only way they knew how to treat mental health illnesses during a time when medication was not yet available. The problem is that shocking your brain does come with risks, and that's why it's important for you to expressly tell the doctor you want this treatment. Forced ECT has side effects like memory loss or confusion. So if you're forced to go through this treatment treatment without agreeing to it, it's like you're asking someone to hit your head with a hammer, which can lead to more mental problems instead of curing your existing issues. This treatment also has been historically associated with abusive practices, particularly in old-school psychiatric hospitals, where it became a symbol of punishment rather than treatment. It left people more traumatized than healed. That's why forced ECT is like fixing a TV by smacking it. Sure, it might stop the static, but you'll get stuck with a fuzzy picture. We know our videos can be shocking, and we're not forcing you to be part of our electrifying community, but we'd appreciate it if you subscribed to our channel and joined our Discord. Euthanasia. Euthanasia is probably the most ironic thing in modern medicine, because instead of doctors doing everything possible to keep you alive, it's the other way around, like asking a firefighter to help set your house on fire. It's also called assisted offing yourself for a good reason, because you go to the doctor to die. Kinda ironic. Suicide has always been a tough discussion in many circles, because there are a lot of people who say that they have the right to unalive themselves. On the other hand, there's a very slippery ethical slope when it comes to euthanasia, because you're no longer just killing yourself, but already asking a qualified medical professional to do it. The thing about the medical field is that doctors are bound to the Hippocratic Oath, which requires them to do no harm. So by assisting in euthanasia, doctors would be crossing the line and violating their duty of healing and protecting life. They're essentially caught between being a healer and being the Grim Reaper. People who argue for euthanasia say that it's an act of mercy for people who are already one step into death's door. After all, if you're already just a few days away from dying, why not take the early flight to the afterlife? But the problem with that idea is that it could lead to people who may want to off themselves even if they aren't terminally ill. This can put doctors into tough situations, or even lead to potential abuses. Imagine a lazy doctor who always prescribes euthanasia over the best but most complicated medical procedure available. That's not a hospital you'd probably want to go to. Chemical castration. You probably know that sexual offenders are common problems throughout the world, especially when you consider that some people tend to have sexual urges so extreme they have trouble keeping their thing in their pants. That's when chemical castration was invented as a possible solution to this problem. At its core, this medical procedure involves using medications to reduce testosterone levels, which in turn lowers sexual drive and function. So from doing 10 rounds a day, your urges are slowly reduced until you can't even think about sex anymore. However, it's a pretty controversial procedure, and that's where the question of bans come in. One major reason why chemical castration is banned in many places is that it raises ethical concerns. The idea of altering someone's body and mind chemically, especially against their will or as a punishment, can be seen as a violation of human rights. It's like you're cutting the balls off a dog because you don't want any unwanted neighborhood strays. In this case, you're doing it to a human with no say in the matter. Chemical castration can also lead to a range of side effects, from osteoporosis to cardiovascular problems. The worst part is that these effects aren't reversible. Once your body has undergone these changes, there's no guarantee that stopping the treatment will return things to normal. Plus, it can mess with more than just sex drive, affecting mood and mental health too. There was also evidence that it's not even that effective. While chemical castration will reduce sex drive, some sexual offenses are more psychological than biological. That means that there are people who are simply too twisted that pulling their sex drive down isn't a guarantee that they would stop their crimes. Symphysiotomy. You're a baby about to be born during the early 1900s. However, your mom is a little too tight down there, making it hard for you to get your head out. So the best solution doctors came up with was symphysiotomy, which is now banned for being a bit too extreme. This medical procedure basically involves cutting the cartilage of the pubic symphysis, the joint that connects the two halves of your pelvis. This was once done to widen the pelvis during childbirth, particularly in cases where a cesarean section wasn't an option. In other words, you were asking the woman to open wide by literally making her opening wider. But imagine being in labor, and instead of a gentle childbirth that you'd remember forever, you're faced with surgery that tends to be on the extreme side of things. Symphysiotomy often caused severe pain and complications for mothers. Women reported issues like chronic pain, mobility problems, and psychological trauma after the procedure. Imagine having to explain to your child why their birth story sounds more like a scene from a horror movie. There were also concerns about the long-term effects on pelvic health, making this procedure a bit like an unwanted surprise party, except the guests are chronic pain and a lifetime of issues. Moreover, the medical community began to recognize that modern alternatives, like safe cesarean sections and better prenatal care, provided much better outcomes for both mother and child. There was no reason to to risk the problems associated with symphysiotomy when there are a lot of safer alternatives. So they decided to cut the drama and go for a delivery that wouldn't leave anyone with a split decision.